Today, our group's talking about understanding and prevention of hospital-acquired MRSA. So just to start, our case study is about a boy named Simon Sparrow, who was a 15-month-old who died of an undiagnosed MRSA infection. He originally presented to the hospital with ear infections, asthma, and a throat infection. Doctors could not identify the source of his infection, so they treated him with broad-spectrum antibiotics. This decision ultimately led to his symptoms worsening as his unidentified infection quickly progressed in a wiped out microbiome, ultimately leading to his death within 24 hours of symptoms worsening. His autopsy report revealed MRSA infection, which is a strain of antimicrobial resistant bacteria. So what is MRSA? MRSA stands for methicillin-resistant Staphylococcus aureus, and it's a group of gram-positive bacteria that tends to lead to skin infections, pneumonia, or even bloodstream infections if untreated. MRSA generally spreads through skin-to-skin contact, but it can also survive on contaminated surfaces. Since 1961, MRSA has acquired many genetic mutations that has led to it becoming the major general antimicrobial resistant bacteria worldwide. Um, this is especially dangerous when patients are not diagnosed correctly and can be fatal when undiagnosed.
So why is MRSA a big problem? First of all, MRSA is resistant to beta-lactams, which are a class of antibiotics that make up 65% of all prescribed antibiotics in the US. MRSA has the ability to degrade beta-lactams, giving it wide-range antibiotic resistance. And the percent of Staphylococcus aureus strains that are resistant to methicillin has risen from 2.4% in 1975 to 64% in 2007. Some MRSA strains have continued to develop further resistance to other antibiotics like vancomycin due to various mutations in their genome.
Hospital-acquired MRSA refers to MRSA infections that occur during medical care. These environments create higher risk because many patients have weakened immune systems or open wounds from procedures. Because MRSA spreads easily if hands, equipment, or surfaces aren't cleaned constantly, this can be considered an important public health concern. So the 5 C's are 5 things that you can keep in mind that describe the conditions that make MRSA transmission more likely in healthcare settings. So crowding increases transmission because infections spread more easily when many people share the same space, especially in a place like a busy hospital. Contamination from surfaces is another major concern because MRSA can survive on equipment, counters, and medical tools, making strict cleaning practices essential. Cleanliness is a protective factor as well because maintaining a clean environment and constant hygiene reduces the likelihood of spread. Moreover, compromised skin and contact provide entry points and direct patient-to-patient or healthcare worker contact also facilitates the spread of this bacteria.
So, as a healthcare worker, in order to stop the spread of hospital-acquired MRSA, you can focus on the following things. Number one is focusing on strict hand hygiene, which means washing your hands with soap and water or using an alcohol-based hand sanitizer before and after every single patient interaction. You can also make sure to use appropriate PPE, including wearing gloves and gowns when caring for MRSA infected or high-risk patients. But be sure to remove PPE when leaving the patient's room and perform hand hygiene immediately after. Healthcare workers can also make sure to clean and disinfect, which means ensuring daily cleaning of patient rooms with approved disinfectants and paying special attention to high contact surfaces, which can include doorknobs, rails, and other points of entry. These are all of our references and image credits. All of the icons and illustrations were from Canva. Thank you for listening.